Okay, so I've been experiencing body pains and twitches for about 5 years now. It started out in my lower back. It started out with waking up in the middle of the night with spasms in my back and dizziness. And it just slowly got worse, and now I live day to day in like a rocky boat. Feels like I'm in the ocean or in the water and just kind of getting washed around, and so I'm kind of disoriented at all times because of the dizziness. And I have episodes where I become completely distorted and almost like it looks like somebody having an exorcism. And I have a lot of pain in my neck, in my jaw, and I have an overall constant feeling of discomfort in my entire body. I never feel comfortable. I never feel relaxed, and it feels like the volume's been turned up on my nervous system. Like everything is just super stimulated and extremely uncomfortable.
What is the level of uncomfort on a scale of 1 to 10?
So the pain right now is probably an 8. It definitely it maxes out very frequently.
What are you feeling right now as you're taking those deep breaths?
My jaw wants to clench and my body wants to twist. And
Okay. I'm going to pass this tray over to you. Go ahead and grab the mouthpiece off of it and go ahead and put it in. What are you feeling now?
right now, that sensation in my body, like everything's turned up, feels like it just got turned down. My body feels colder, cooler, and more comfortable, much more comfortable. My neck is relaxing. I still have some pain in the back of my head. A very small percentage of what it was.
Tap, tap, tap on the mouthpiece a couple times. There you go. And just relax on it. How many doctors have you seen for your condition, and what have you tried over the years?
So, I've seen 5 doctors, 4 neurologists and 1 neurosurgeon. the first doctor was a neurologist, and he told me that that it looked like dystonia, but that he wasn't quite sure. So he sent me to another neurologist who said, I don't know what's wrong with you, but I think it's going to go away by itself. Then I requested to see a third neurologist, and he told me that it was something called conversion disorder, where my mind is incapable of handling stress and converts stress into physical symptoms. Then from there, I actually went back and saw the first neurologist, and he agreed that it was all in my head, and that if I needed to see him to talk about it, that I could at any time, and then he sent me on my way. But before that, he had me try, Klonopin and Artane, both of which made me almost non-functional. I had to be on such a high amount to suppress everything that I was a zombie, and so I actually went off the medication within 6 weeks. From there, I saw another neurologist, and he said I have torsional dystonia, but that he didn't know what the cause was, that didn't know why it was happening, and he put me on Cinemet, and I was on Cinemet for about a year, and after no improvement, I was taken off of Cinemet, and since then I've just been on a trazodone to help me sleep, because at night seems to be when my symptoms can be the worst. As I said earlier, that's how it started, was waking up in the middle of the night having spasms and dizziness, and so taking something to knock me out at night was beneficial. From there, that doctor wasn't satisfied with the torsional dystonia diagnosis, because he couldn't determine what was causing it. So I was then referred to another doctor at UCI, a neurologist, who then said I have functional neurological disorder, and that he referred me to a website called neurosymptoms.org, and he said anything you need to know is on this website. The website describes patients with symptoms with all sorts of varying, from basically anything that you can have wrong with you. This functional neurological disorder covers it, and it means that your brain isn't functioning normal, that there isn't something wrong with your brain, but that it doesn't fire correctly.
Okay, so let me ask you, now that that mouthpiece has been in for a minute or two, how's your brain functioning now?
I feel way more clear-headed. I feel way more, there's no other way, but I feel clear-headed.
Alright.
Like a fog has been lifted. Almost like. No, I'm not distracted by dizziness or by pain.